So interestingly, from population studies, we know that probably around 44 out of every 100,000 person years suffer a vessel occlusion in the United States. Only 11 of those get thrombectomy. So 1 in 4 patients get thrombectomy when, with the proper vetting, with the proper access to care, with the proper indications, that number could be higher. There are a lot of barriers to that. Part of it is the indications themselves, the guidelines. As we know, every time the guidelines change, practices change, the volume of thrombectomies go up, and so we are kind of in the phase that is anticipating the new guidelines that would expand the indications for thrombectomy. The other limitations for access to thrombectomy are the geographic limitations. There seems to be a higher percentage of patients undergoing thrombectomy on the East Coast compared to the West Coast, so that's something to be investigated. But also, there is 1 in 6 patients in the U.S. Who suffer a stroke do not have any access to thrombectomy at all, neither as a gateway to a hub or landing at a hub directly. And so definitely there are systems of care that need to be readjusted and ways in which we can identify those patients and get them access to the treatment that is life-saving in a timely fashion.